Hello. So today I'm going to talk to you about mammary cancer in dogs and cats. So, mammary cancer is just like it would sound. It is cancer in the mammary chain or the breast area of a dog and a cat. Now, obviously, dogs and cats have more mammary glands than humans do. Typically, they're going to have two mammary chains, so on the left and right side of their abdomen. It depends on the animal, but you'll see some that have, 6 nipples, some that have 8, some that have 10, and each one of those glands has the opportunity to develop cancer. Typically, mammary cancer is going to be hormone driven, so the more heat cycles they go through, the more likely they are to have this problem. In cats, it is a little bit more likely for mammary cancer to be malignant or spread and be aggressive than in dogs, but it is a decent chance of malignancy in both breeds. I personally suggest, just like they suggest for women, doing a self-check once a month. I suggest once a month, once every 2 months for dogs and cats, that you just run your hand over their belly and make sure that they don't have anything coming up. Mammary tumors can be a little weird. Some of them will have a tiny little pebble. Some of them will get these big giant tumors that are on there. The kind of classic, if we're presented with an animal for that, is one, to do chest x-rays. Now, the reason we're doing that is if mammary cancer is going to spread, the most common place is going to be to the lungs or to the chest. And the majority of the time, if we do x-rays and there's cancer in the chest, we're not going to do surgery for the animal. And that's just because it doesn't really improve their quality of life at that point. If it's already spread, then they're close to the end, unfortunately, already. If they pass that, what we call met check, or looking for spread in the chest, then the next step is to figure out how in depth of a surgery we're going to have to do, and that depends on how many masses we have and where they're located. Some animals will just remove one mammary gland because they only have one tumor. But if you have multiple tumors on the same mammary chain, usually we will remove the entire chain. When it becomes really complicated is when we have to remove both chains on an animal. There's not, in most cases, enough skin space on the abdomen of an animal to remove both chains at the exact same time and be able to close it and have a good heal of the area. There are some things that we can do in surgery to increase our chances of those types of areas healing, but it's going to have a high risk of complications to do that. A lot of situations like that, they'll remove one chain, let it heal, and then remove the second one, but then you run the risk of it spreading in the meantime and whatnot. So your best bet is to be checking frequently, and if you find any masses or lumps or bumps, getting them removed when they're small so that you don't have to worry about this. Now, every veterinarian has seen the case where there's been a mammary mass, it's been there forever, the owners elected not to remove it, and then all of a sudden it just grows like crazy. And mammary masses are one of the types of tumors that frequently, if they're left to their own devices, will grow large enough that they outgrow the skin in the area and they can actually rupture and get infected. Once that happens, that mass is never going to heal because it's abnormal tissue, and abnormal tissue doesn't heal. So at that point, it becomes a quality of life concern. If you cannot remove the tumors, or you're not willing to remove the tumors, then you kind of have to start asking yourself questions about euthanasia. Now, the last little bit is, if you're doing surgery for mammary cancer on an animal that is intact, they're not spayed, it is recommended to spay them at the same time. That way you're removing that hormone source and hopefully eliminating their potential to develop more mammary tumors in the future. It doesn't 100% eliminate the potential, but it does make it significantly less.